This is Abia COVID-19 update. Abia COVID-19 update. Nine 159,224 have recovered since the outbreak began, with global death toll at 218,024. The United States, by far the world's worst affected, has reached the milestone of 1 million confirmed cases. United States death toll is now at more than 57,000 people, with 142,238 recovered cases. Now, Nigeria announced its highest number of confirmed coronavirus cases yet, with a figure for yesterday at 195. The figure brings the total tally for the country to 1,532. The total number of those discharged is 255 and deaths 44. And the Lagos state remains the epicenter of the disease in the country. Also, new cases were reported in Kano after about 6 days due to the suspension of the testing activities in the state. But in Abia State, recent test of the 2 COVID-19 patients was mentioned about by the Honorable Commissioner for Health yesterday, and he maintained that aggressive contact tracing is ongoing in specified areas and called for the cooperation of the people within the affected communities. Away from the policy decisions, government direction, and steps taken by the Abia State government to curtail the spread of this virus, today we are turning our attention to the practical details of COVID-19, especially as it affects the state. As I do have the state epidemiologist right in the studio, Lady Peace Unwogugu. That's what we do call her. Lady P, good morning to you. Glad to have you join us this morning.
Thank you, Michael. Good morning. And good morning, very good morning to my people, Abia State.
All right, glad to have you join us in the studio this morning. Let's talk about the index cases that we have in Abia State. Can you give us the latest and update on the 2 cases, septuagenarian?
Yeah, concerning the 2 cases in Abia State, they are quite stable. Considering their ages and their underlying ill health, they are responding very well to treatment.
Okay.
As at the report, as at this morning, says that they are responding well and they are in a stable condition.
Interesting. So how many index cases have been identified? Like, okay, 2.
Yes.
How many contact tracing have been identified?
Okay, so far we have been able to identify, line list and follow up total of 262 contacts.
262.
Yeah,
I know you're leading
index cases.
I know you're leading that particular team.
Yes.
So let's talk about what you encounter. You've been to 3 local governments, Umuahia North, Ukwa West, and one other local government, Ikwana yeah. Local government. So let's talk about how you go about this contact tracing when you leave Umuahia down to maybe Ukwa West. How do you go about the contact tracing?
Yeah, you know how the roads are, and considering the enforcement of this lockdown order, it has not been very, very, very easy, because as a matter of fact, there is lockdown order in the state, but I don't think our people are really following this lockdown order, as we still see many persons on the roads, and the law enforcement agencies, the people who now oversee the enforcement of these orders, are not even helping matters, because sometimes they impede our own movement. Even when they receive calls from high place people, like for Honorable Commissioner for Health and for Information, they will still insist on keeping us on the road. It's quite demoralizing. It has not been encouraging us, because the time we will spend on the queue for us to leave is the time we would have used to get to our destinations and continue to do our work and respond to this outbreak the way we are supposed to do it.
All right, let's talk about some of this contact tracing. Is it difficult in getting across to them? Because I understand that some persons will call the team to get across to them, give some symptoms that they are exhibiting, and when you get there, you won't see them, probably false calls.
Yeah, as per the contact that we are tracing, initially it was not easy. Like Okwa West was not easy, but on Sunday I led the team to Okwa West. Then the chairman was there, the honorable house member was there. They led us to the SS Palace, and the relationship was established. So Okwa now is no longer a problem, but we still encounter problem when we go to trace maybe somebody and the person might not really be around, or the person is around, answering to calls might not be easy. And that one is not even the main matter now.
Okay, what is the main matter?
The main matter now is that people call us, they send alerts, they will call NCDC, they will call Abia Telehealth, and when these reports or signals get to us and we want to trace them, you see that it's just an act of mischief. The person will not be available, or the person has given us a misleading information, that tracing them will be difficult, and we waste our precious time, we waste the resources that would have been used to respond to people who are in real need on people that are playing pranks. I think it's not encouraging, because what we need is to respond to people who need our attention. These lines are not open for people to joke with. It's not a matter right now. The nation is not in a situation where people will play pranks or joke with things like this. We should be serious minded. If you are making a call across to NCDs, you be sure that you have need. If you are making a call to Abia Telehealth, you be sure that you have need. And when we try to respond, please, let's be available for the frontline responders to respond to our call.
All right, I would like you to talk about how long it takes to get the result from a particular sample. I understand that you do send testing samples to Ebonyi State. That's the closest testing center to Abia State now. How long does it take to receive a result on a test sample?
It takes at least 48 hours.
That's 2 days.
Yes.
To get a result of a particular sample.
Yes, considering the bulk of samples they get in a day.
How many samples have been tested so far in Abia State?
We've tested at least we'll have up to 56 negative tests that have returned.
56?
Yes.
And how many persons are there at the isolation centers, talking about the index cases and the contact traces now?
No, the contacts are still at the treatment center, but they've
not been isolated.
They're in isolation now.
Okay.
That means in isolation. But these contacts, so many of them, the high risk ones, have tested negative, and they were in isolation before now. So their results have been released negative. But most of them also are in self-isolation. Some even have traveled, left where they are living in the town, gone to the village where they will be able to self-isolate from their families. So right now, all the high-risk contacts are in isolation.
So what do you
mean?
All
the contacts are in isolation.
What do you mean about high-risk contacts?
High-risk, when we get these contacts, we try to categorize them based on the level of exposure to that index case. So some have more risk than the others, depending on your intimacy or if you're a health worker, what you were able to do, what you did on that case. That is how we categorize. We categorize to high risk, low risk, medium risk.
Okay, so that's the level of contact with the index
with
case.
The index case, and the high risk presence, they're investigated.
Interesting.
Laboratory investigation.
It is Abia State COVID-19 update. It's a daily program that runs simultaneously on several radio stations right here in Abia State. I would like to take you on some precautionary measures. What we still need to do now. We have 2 index cases in Abia State, and several samples sent to the NCDC testing center there in Abakaliki, Ebonyi State came back negative. Does it mean that we are totally safe from COVID-19 in Abia State?
Talking about the index cases, there will be the guideline stipulate that they will be tested again, and they have been tested again. In fact, they will undergo 2 more tests before we will now say they are free from the virus. And it does not mean that we will relax. Having these index cases being free, maybe they have been undergoing treatment, they are free now, does not mean that the state will relax. We will still keep on observing all these precautionary measures, washing our hands frequently, staying safe, maintaining a safe distance, being at home, staying safe. it does not mean that these cases ends at these 2 index cases. There might still be chances of infection, chances of transmission ongoing.
All right, we're talking about community transmission in Abia State.
Yes.
Now, the primary case that led to having 2 index cases in Abia State is yet to be identified. Is that a cause for worry?
It's not quite. It's a cause for worry because we really need to pin down the source of the infection. The person probably might have recovered, because for these people to be infected means that there was an asymptomatic person, somebody that has this virus but without symptoms, probably showing any signs and symptoms of this virus. And because of that, we must be more courteous in all that we do. We must operate with caution. Wherever you are, consider the next person to be infected.
We have symptoms like a sore throat, cough, and sneezing. Fever. It might be mild, it might be acute, depending on the level of infection
and the immunity of the
immunity of the patient. Now, you're saying that it is possible for someone to have COVID-19 and will not present
with any of these
symptoms.
Yes.
Interesting.
Yes.
So in such a case, what should we do?
Because you don't know that person has this infection, considering the fact that he's not showing any symptoms, what we advise is that you maintain social distancing from everybody, because you don't know the activity of your neighbor or your friend. You don't know where he has been, whom he has been in contact with, and you don't even know whether he has been gotten infected without showing these symptoms. That is why this order of lockdown is in place. That is why the order of social distancing is in place. That is why the measure of utmost hygiene, hand hygiene, is important. That is why the rule of wearing face masks whenever you are going out is in place. And if we're able to observe these rules, especially the wearing of nose mask, as the governor has directed, I think we all will be safe. If I'm wearing my nose mask and my friend or my neighbor is wearing his nose mask, if I'm infected, I won't infect that person. If that person is infected, he will not infect me. All of us will be safe, and the virus will now die. Will not see anybody to infect. The virus does not move, but humans will move, and when we move with the virus. But if we stop the movement, if we break the chain of transmission by wearing our nose mask, by maintaining social distancing and observing utmost hand hygiene, this chain of transmission will be broken, and the virus will not see anybody to infect.
Interesting. It is Abia State COVID-19 update, and of course we will go for a break now. When we return, we open the lines for you to ask questions concerning COVID-19. I know you have a whole lot of questions concerning COVID-19, the myths, how it can be transmitted, and of course how you can stay away from contracting COVID-19. We will be right back.
This is Abia COVID-19 update. Abia COVID-19 update.
It is still Abia State COVID-19 update live on BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, all in the capital of Abia State, Umuahia, and Bose 89.7 FM and Real 99.1 FM, both in Aba, the capital, the commercial capital of Abia State. I still have here with me Lady Peace Unwogugu, that's the Abia State epidemiologist. I know you have questions, but before we open the phone lines, we're still monitoring the level of awareness and compliance to the necessary directives by the Abia State government. And we are joined this morning by a journalist, Dende Destiny from Ukwa, all the way from Ukwa West, the local government area of Abia State. Destiny, good morning to you.
Good morning, Michael.
Glad to have you join us this morning. We want to know the level of awareness and the compliance to the necessary directives by the Abia State government at that end of the state.
Thank you very much. You know, ethnic nationality is divided into two, the Okwa West and the Okwa East. I am reporting live from Okwa East. The level of awareness here is high. The compliance value is equally high, with a few deviants, which you must not allow.
Okay, Destiny, I want to know the level of compliance to the stay-at-home order by the government and also the curfew, 6 p.m. to 6 a.m. curfew imposed by the governor.
The state of compliance, I may say, in percentage, is up to 85 to 90%. The local government chairman, who is an agile woman, the only woman local government chairman in the state, Chief Mrs. Stella Ibokwe, is doing her best, moving from village to village to enforce compliance alongside with her committee. So the rate of compliance is equally high. It's okay. Though you cannot rule out some skirmish.
All right, Dende Destiny, thank you very much for joining us this morning on Abia State COVID-19 update.
Thank you. The pleasure is all mine.
All right, now it is time for you to ask your questions concerning COVID-19, what you need to know, some of the questions you've been keeping, waiting for a medical expert to answer. It is time for you to obey those questions now. 0808 182 6949 or 0811 605 2949. Also drop messages on 0906 510 8289. Good morning to you.
Hello.
Hello, good morning.
Good morning. My name is Chimnachikes. I'm calling from Umaya.
You're welcome. What's your question?
Yeah, the question I want to ask that when a infected person wants to plan to visit someone,
I can't get you. Can you speak up? Probably change your location.
No. I want to ask, as an infected person wants to plan to visit someone, he knows what's the first thing the person will do.
Did you say if an infected person wants to visit somebody,
Okay.
what the person needs to do?
Yeah.
All right.
An infected person, maybe you are suspect that you have been exposed. Who knows? Probably you have been infected. Is it the question?
He's off. So I don't think there is any need for
if you are
an infected person to travel.
You stay indoors. Alert us. If in fact the thing is, if you know you've been exposed to somebody who is infected or to somebody who has come back from these places with active community transmission, all you need to do is to let us know so that probably we will take your sample for laboratory investigation. You self-isolate yourself. You don't need to mingle with other people.
All right, let's entertain more calls. Good morning to you.
Hello.
Hello, good morning. We lost that. Good morning to you.
Yeah, good morning, brother.
Good morning. What's your name?
Yeah, my name is Zion, calling from the Data South.
Welcome, Zion. What's your question?
Yeah, please, man, I want to ask only one question, man. How many people...
Hello, Zion. How many people?
Yeah, this sickness have killed in Nigeria, man.
All right. Yes, I did reel out the global update during the start of the program, and we have in Nigeria, the number of fatality is presently at 44. So 44 deaths have been recorded in Nigeria. Hello, good morning to you.
Hello?
Good morning.
Yeah, good morning.
You're welcome.
Thank you very much. Please, I wanted to know how someone can self-treat himself if he has a suspected case of exposure to coronavirus.
Okay, what's your name, please, and where are you calling from?
My name is Izuchiku. I'm calling from Umahia.
All right, you're welcome. Asking for steps to self-isolate.
Okay, thank you very much, my brother. If you know maybe you have been infected or you were exposed and you want to self-isolate in your house, take a room only to yourself, most preferably a room that is self-contained, that has toilet and bathroom. You don't come out and mix with your family members. If you need anything, your family members will drop it on the door. You open the door, collect it, stay back. If you need anything, you take your phone and call them. You'll be communicating via phone. You don't need to come out and be staying with them. You do everything all by yourself inside your room and observing utmost personal hygiene of yourself and that room. Make sure you clean the room very well, the surfaces of that room, your toilet, even the doorknobs.
All right, there is a message from engineer Silas from Imo State. Please, can COVID-19 be transferred through money and buying and selling?
Very much possible. The currency notes we are holding can be contaminated, and once you handle cash, you need to always wash your hands or sanitize your hand after and before handling cash.
Okay, and there is another message here. Is the testing for COVID-19 free of charge?
100% free of charge.
Okay, that's if you're confirmed positive, you will be treated free.
Yes.
And there is this insinuation, I don't know, call it a rumor on the street, that if you're infected, you will be given a sum of money for being infected, they're close to about ₦1 million.
That is absolutely not true.
All right, let's entertain more calls. So good morning to you.
Hello, good morning, Michael.
Good morning, you're welcome. What's your name?
My name is Abia. I'm calling from Iraq, Abia State.
Welcome. Quickly, you have 30 seconds.
So, I would like the program you have been doing. What I want to ask, those people have been affected in the case of COVID-19, have they recovered?
All right. Those people where? In Abia State?
Yeah.
Where?
In Abia State.
All right. He's asking for the condition of the index cases in Abia.
These index cases, they have some underlying illness, for which reason they were admitted at the hospital. And up till now, they are very stable, which means they are recovering.
All right, Lady Peace Unwoguru, I want to really appreciate you for your time on the program this morning. Definitely, we will continue we will be continuing this sensitization, definitely,
yes,
in subsequent editions of the program Abia State COVID-19.
Thank you very much, Mike. Please, Abians, stay safe. Observe all the rules. Wear your face mask whenever you are going out. As much as possible, stay at home. Observe utmost hygiene.
Very important. Observe utmost hygiene. Many thanks to BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, Boz 89.7 FM, and Real 99.1 FM. The program returns tomorrow. That will be the Thursday edition of the program. My name is Michael Oni. Stay safe and take responsibility.
This is Abia COVID-19 Update. Abia COVID-19 Update.